Good afternoon and welcome everyone. I'm still seeing people jumping on. So we'll start a little bit slowly, but we'll get rolling in just a minute. It's awesome to see so many people joining us today for our recovery and wellness series. So I will just get started and people will be joining us as we move forward, but we have a really important topic and a short amount of time, so we'll start promptly. So again, welcome. Thanks everyone for joining us for Granite Wellness Recovery and Wellness Series. Wow, we've been doing this actually for a number of years now, probably almost 8 years with different awesome partners. And today I really want to acknowledge the Youth Opioid Response California grant program that's helping bring this to us today, as well as our partnership with the RX Safety Coalition. Today, as you know, and again, so glad to see so many people registered. I know that our community understands the gravity of the challenge that we're facing in addressing opiate use disorders, and right now, particularly concerned about the local fentanyl crisis. So today we'll be talking about, spreading awareness around these and also specifically providing information about medication-assisted treatment and naloxone. And, really there are, I think, 3 key messages we want to make sure to share. And one is how dangerous fentanyl is. Many people know this. Many people still don't. We're particularly concerned about young people. Also, the presence of fentanyl in multiple other substances, and Sheriff Moon might speak a little bit more to that, but we know that so many other drugs right now are laced with with fentanyl, such as heroin, fake and counterfeit prescription pills, cocaine, meth, and other substances. So we want people to know it's dangerous. We want people to know it's prevalent right now in substances they may not think it is. And really importantly, we want people to know that there are multiple ways to get help and support, both through treatment, intervention, and harm reduction. So today we'll specifically be talking about medication-assisted treatment, as well as providing the ability to access naloxone, also known as Narcan. On that note, we want people to pay attention at the end of the slideshow today and the presentations. There will be a link to a survey, and this is where you can indicate that you'd like to pick up a free naloxone or Narcan, as its known brand name, at one of our sites. And that's where you can fill out this brief, it's like 3 or 4 question survey, and then we'll know where to have a Narcan kit waiting for you. We also have the Q&A open, so if there are questions, you can submit those through the Zoom app. And then before I introduce our first speaker, just want to mention, we'll have Alexa Curtis, who's Dr. Alexa Curtis, a nurse practitioner, will be providing information on medication-assisted treatment. Gabe Ramirez, our PA here at Granite Wellness Centers, will be providing information on the naloxone training, and then we'll also be sharing other resources in our communities in Nevada and Placer County outside of Granite Wellness Centers as well. We have a lot of incredible partners through our county partners, as well as other local healthcare providers that are part of our community's really tremendous response to addressing this concern. So thanks again for being with us today. Don't forget the survey at the end. We welcome your questions. And I'm so glad and honored to be able to welcome Nevada County's Sheriff Shannon Moon to say a few words today as well. Thank you so much for being with us, Sheriff.
Thank you, Ariel, and thank you for the partnership. I think that's the big takeaway that I see locally here, is just the partnerships throughout all of the different work environments that we have here in Nevada County, that everyone is trying to truly make sure that we have a safe community. I am Shannon Moon. I am the sheriff here in Nevada County. And the role in which your sheriff's office has with something like this is, it's complex, because we're on the front line when we're out in the community and we see folks that are addicted and have some the drug addiction issues. And then in the incarceration world, over here at our local facilities, our Wayne Brown facility here in Nevada City, and our Truckee facility in downtown Truckee, and just, what kind of health and mental health services can we provide for our incarcerated population. And then I'm also your coroner here in Nevada County. So and clearly, the overdose issues that are happening. We looked at the numbers early last month, and we clearly started seeing the trends, and we thought we really needed to put that information out to the public. And in doing so, just having having that conversation, I think that's really important for folks to see the data, not look at it within our silos of our community, but look at how we can collaborate with the folks at Granite Wellness, with our medical staff here at our facilities inside the jail, our hospital staff, and then our other law enforcement partners, Grass Valley Police Department, Nevada City Police Department, and the Truckee Police Department. So that was the reason for our post. If you saw the numbers, we're looking in 2020 of having already 23 overdose deaths in Nevada County. And of those 23, 14 have had a positive return on a toxicology for fentanyl. That's unheard of for us. 2019, we had 6 overdose deaths in Nevada County, 0 fentanyl. So we see that upstick, and it's alarming, and we want to do whatever we can with our information to collaborate with our partners to make sure that we get the information out to the public. So, I'm happy to be here, happy to answer any questions that the public has, and just recognize that the Sheriff's Office is here in partnership with all of the folks that are trying to do their best out in the community. And I think we're going to go to Alexis.
Yes. Hi. Thank you, Sheriff Moon. And once again, thank you for the partnership that we do share with the Sheriff's Office as well as the rest of the community in addressing this crisis that we have. Go ahead and start our slideshow. So I am Alexa Curtis, and I am part of the care team, the medication assisted treatment team here at Granite Wellness. And as our CEO, Ariel, already stated, I'm both a family nurse practitioner and a psychiatric mental health nurse practitioner. And I have been here at Granite Wellness for almost 3 years now, helping address the need in this community. And I'm not seeing the slides. Now I'm seeing the slides. Thank you. So I'm going to go ahead and start with a basic introduction of what we're talking about when we're talking about, so now I'm going to go back. go ahead and flip back to our mission statement. Thank you. We have the wizard controlling our slides, so I appreciate that. We are here at Granite Wellness to assist in people's recovery with a variety of substance use disorders, and it is our overall mission to promote wellness and quality of life for individuals and the community. We recognize that recovery is a process of change, and we are here to facilitate that process for individuals and families in need. Next slide, please. So a brief overview of the terms opioid, opiate. You will hear these interchangeably. Really technically, the word opioids refers to all of the drugs, whether they're natural drugs, semi-synthetic, partially man-made, or synthetic, all man-made. So we're talking about heroin, fentanyl, pain medications that are available through prescriptions, such as oxycodone, hydrocodone, codeine, morphine, and many others. So opioid is the grand umbrella. Opiate refers to natural opioids, such as heroin, morphine, and codeine. And so you're going to see in this slide set and in the literature and in our discussions in the community, those words used interchangeably. I'm going to stop and address fentanyl specifically momentarily, why fentanyl is so dangerous. So fentanyl is a fully synthetic, a fully man-made opioid, and it is 50 times stronger than heroin and 100 times more potent than morphine. So you can, and what we know is what's always been addressed is fentanyl is available, is a legal product and has medical indication. But what we also know is fentanyl is coming over into our communities illegally and is infused in other substances, as already was discussed, and is extremely dangerous. Next slide, please. Okay, so what do? We treat what's known as opioid use disorder. And so what does that mean? do we know a person has an opioid use disorder? There's a list of diagnostic criteria, which I am not going to go through, but overall, obviously the person is using an opioid for a prescribed reason, most commonly happening through the treatment of chronic pain or an injury. They started on an opioid to treat their pain and then developed an opioid use disorder from the use of a prescribed opioid. Then we also know that there are opioids that are not prescribed, such as heroin. There's no medical indication for the use of heroin. So regardless of which substance it is, the person is taking an opioid. And an opioid use disorder may manifest by some of these symptoms. So all of a sudden the person finds that they are taking larger amounts than was previously needed to control pain, let's say, or larger amounts than they had originally intended to use, or that was prescribed for them for their health condition. They may find that they are wanting to cut down and are trying to cut down on their opioid by themselves, taper back by themselves, or in conjunction with their medical provider, and that they simply are not able to cut down on that medication. They have cravings, a very strong internal desire for the drug. And here's a big one, that they continue to use the drug despite negative consequences. So these consequences could be health consequences, one being risk for overdose. They could be social consequences, such as disruptions in their relationships, disruptions in the ability to do the things they used to like to do, disruptions in their employment or interface with the legal system. They are finding that they're developing what we call tolerance, which means that they need more and more of the drug in order to achieve the effect that they are looking for. And they may find that when they stop taking the drug, that they experience significant withdrawal symptoms. So withdrawal symptoms from an opioid are basically a really, really bad flu-like symptoms. The body aches and the runny nose and runny eyes and gastrointestinal systems. It's like the worst flu that you've experienced. Next slide, please. Next slide. There we go. Okay, so the take home here is whether the medication has been, or the medication, drug, however you want to say that, has been prescribed or not prescribed, whether the opioid is a natural opioid like a heroin or a man-made opioid like a fentanyl, the treatment is the same. And so the way we treat opioid use disorder is, you've probably heard that it's been on the television, commercials for MAT, so medication-assisted treatment. The other way people say this is medications for opioid use disorder. And overall, it's the treatment of opioid use disorder with 3 different types of medications, and often and generally recommended in conjunction with some type of behavioral health therapy, whether that is a support group, a 12-step program, individual counseling, or a combination of all of the above. Next slide, please. So the overall take-home message here, the one, if you have to walk away with just one thing, walk away with treatment works. Treatment for opioid use disorder works, medication-assisted treatment, and recovery happens. And here at Granite Wellness, we see it over and over, day in, day out, that what we do here changes lives. Next slide, please. So a very brief overview on what are these medications that treat opioid use disorder. In general, there are 3. When you hear people talk about these medications, there are 3 different medications. One is methadone. The other is buprenorphine, most commonly known by people as Suboxone, which is the brand name. And the other is naltrexone. So each of these medications works in different ways. All of them, in some way or another, work on that opioid receptor in the brain. Methadone has been around a long, long time. Used well before buprenorphine or naltrexone. And what methadone is an actual, what we call a full opioid. You'll see in the next slide the words agonist. That just means it works as an opioid. It attaches onto that opioid receptor that you see there fully, like a full opioid. So, there's really no difference in how methadone works compared to, say, oxycodone or heroin. Buprenorphine, a newer medication, is what we call a partial agonist. So it partially connects into that opioid receptor. It doesn't fully, fully fill that receptor like that methadone does. It partially connects to that receptor. And then naltrexone has a whole different effect. It blocks the effect of opioids. So methadone and buprenorphine were very similar because they have an opioid-ish effect. Naltrexone is different in that it blocks the effect of opioids. Next slide. So when you're looking at the 3 different types of medications, you're looking at, okay, so what is the opioid effect? Therefore, why would we choose to use this medication? So again, remember, a full opioid antagonist like naltrexone or naloxone, Narcan, which we're going to be discussing later as a reversal for opioid, it blocks the effect. You no longer are having the symptoms of being on an opioid when you take the full antagonist, naltrexone, naloxone. The partial agonist, like we talked about, is partially sitting in there in those opioid receptors, and therefore, like buprenorphine, Suboxone, you're getting a partial effect. So what's the therapeutic reason for that is that we can then sit into that opioid receptor, and what it does, the buprenorphine, is it stops the craving and it stops the withdrawal symptoms without the full effect of an opioid, a full agonist, whether we're talking methadone or heroin or oxycodone. So what would be the full effect of an opioid? Well, intoxication, euphoria is, the use, or the misuse of an opioid. And also if used in excessive amounts, overdose death. So as you can see from this little graph, buprenorphine doesn't do that because it's partial. It has what we call a ceiling effect. It stops. It stops at reducing cravings and withdrawal symptoms, and it stops at causing the euphoric effects of a full opioid and the potential overdose effects of a full opioid. Okay, next slide. So the 3 medications for medication-assisted treatment or medications for opioid use disorder: methadone, buprenorphine, Suboxone, naltrexone. So why would a person choose one medication over another? And there are great reasons to choose each of the medications. And the care for someone with an opioid use disorder is very individualized. So methadone, been around a long time, lots of data on it, good effect in terms of reducing opioid overdose deaths and controlling cravings and withdrawal. Because it is a full agonist, because it fully fills up that opioid receptor, it is effective for managing chronic pain. So that might be an indication that someone chooses the methadone route. It is taken daily. So that's a consideration. You have to take your dose every day. And a big consideration with methadone is that it must be dispensed by a methadone treatment facility for most people on a daily basis. So people go to a methadone treatment facility and they pick up their dose daily. And the reason for that is it is a full agonist. It's a full opioid. Therefore, there is the risk of overdose death with it if too much is taken, and there's risk of abuse. It is a full opioid. So then the next medication to consider would be buprenorphine, Suboxone. It does the same thing as methadone in terms of reducing cravings and withdrawal symptoms. It also can assist with chronic pain, not as effective as a full agonist, but it can be useful with chronic pain. Because it's not that full agonist, that fully connecting to those receptors, there is a lower risk of abuse with buprenorphine. It is also taken daily, but the advantage here is it can be prescribed by a treatment facility like Granite Wellness and medication-assisted treatment facility. It can also be prescribed by your primary care provider if your primary care provider has received an additional certification in prescribing and managing these medications. You can take home your prescription like you would take home your prescription for, your hypertensive, a person's hypertensive medication. And the person does not need to come in and be daily dispensed from a treatment facility. And, there is a injection form available that provides a month's worth of medication. So that is a very, a favorable option for some people as they move along in their recovery. Then again, naltrexone, again, so this is a whole different type of medication. It actually stops any opioid effect. So if you have naltrexone on board, you take an opioid, there's, no effect. Usually we do give that in a monthly injection. There is a daily pill form available, but that's less commonly used. It is not addicting, it's not sedating, and you do have to be all the way off your opioids before you take naltrexone, or it will kick all that opioid off your receptors and you will go into a pretty severe withdrawal. Okay, next slide. Okay, so I'm going to really pivot and focus on buprenorphine because that really is the mainstay of therapy now for people with a moderate to severe opioid use disorder. And is what we do here at Granite Wellness. If you come to us at Granite Wellness and you are interested in pursuing methadone treatment, or we may do an assessment and decide that the patient is best suited for methadone treatment, we would refer you to another facility that provides methadone. We do naltrexone, and we have many patients here, several patients here on naltrexone, and to note, naltrexone is also used for alcohol use disorder. But we're going to spend the rest of our time here focused on buprenorphine. So someone is interested, has decided through discussions with their primary care provider, or within themselves and their family, that boy, they think they have an opioid use disorder and they want to get treatment. So what would that treatment look like? So for us, at first you would come in and we would do an initial intake assessment, a history of physical, make sure the person is a good candidate for buprenorphine. And then standard of care in all treatment facilities is we perform urine drug testing to see which substances, confirm which substances are still on board in a person's system. And then once we've decided that the person, jointly have decided that the person is a good candidate for buprenorphine, we would start what we call a buprenorphine induction, which is getting that buprenorphine on board. So what's important to know is when you start your induction, you need to be in a little bit more than a little bit. You need to be in withdrawal, generally about 24 hours since the last opioid dose. So you need to have some withdrawal symptoms, because if you don't, what happens is that buprenorphine comes in and it kicks all of the opioids off of the receptors, ones that were already sitting there, because buprenorphine has what we call a very high affinity for the receptors. It attaches more strongly than the other opioids. So it swoops in and kicks everything off. And you don't want to do that, because then you end up in very severe withdrawal. We call that precipitated withdrawal. Often people that I talk to come in for treatment have accidentally gone there before and they never want to go back there. So we have the person is in withdrawal when they come in, and then we start dosing them with buprenorphine until their withdrawal symptoms are gone. So this is not a prolonged multi-day withdrawal. This is, we keep dosing you until those withdrawal symptoms are gone. And it is pretty miraculous to watch a patient come into the office, be uncomfortable, be in withdrawal, and we get that buprenorphine on board, and you visibly see those withdrawal symptoms going away. Once we get that induction done, we generally check you back. You go home. This is done outpatient. It can be done inpatient in a residential facility, but we do most of this outpatient. Then you go home. You have instructions for the next 12, 24 hours until we see you back the next day. See how you're doing, adjust your dose. And generally, once we get you stabilized, we have you come in once a week for a while, checking on your dose, checking on you, checking on side effects, and managing it that way. Once you've been stabilized on weekly visits for a while, then we would generally move the person to a monthly visit. We generally don't go beyond a monthly visit. And again, what we're looking at is this dose working for you? Are you having any side effects? You are also referred to and encouraged to participate in our medication-assisted treatment support groups and referred to outpatient therapy for further behavioral health support in treating all of the other aspects of the opioid use disorder. We do visits via telehealth, particularly during COVID. So know that not being able to physically get into the facility is not, weekly or monthly is not necessarily a barrier to receiving care. And the duration of treatment is very individualized. This is one of the big questions that always comes up. How long will I be on this? There's no real answer to that. There's no good data that says we need to take people off of this. In fact, what we know from the research is when people stay on their buprenorphine for the treatment of opioid use disorder, they stay in recovery. That does not mean that people don't come off. Many people do come off, but this is a very individualized decision. Next slide. Next slide, please. There we go. We also treat youth, and this is very important. As Ariel, the CEO, mentioned, we have a program specifically for treating opioid use disorder with youth here at Granite Wellness. Buprenorphine is approved for youth over the age of 16, and we can do that here at Granite. Buprenorphine has been also used in what we call an off-label use for younger clients. We would work with the local pediatricians in order to make that happen. The medication has been demonstrated effective for youth in conjunction with other supportive behavioral health therapies. Next slide. So overall, what to expect? When a person comes into Granite Wellness for treatment for the opioid use disorder, we are going to manage those withdrawal symptoms. We understand those withdrawal symptoms are awful for the person, and it's often the reason that people don't engage in treatment. We are not going to let people suffer. We can bring people in, get them on buprenorphine. Within the span of a few hours, we will have those withdrawal symptoms controlled. We also have other medications that we can use to help with some of the common withdrawal symptoms of opioid use disorder, stomach upset, anxiety, those types of things. But important to know, we will manage those withdrawal symptoms. We will manage cravings. People get on buprenorphine and I will ask, any cravings? Nope, no cravings. So most of the time we can get people on a dose of buprenorphine that keeps those cravings under control. You will be treated as an individual. We understand that the recovery process is a very individual process, and you will be treated with compassion. You will be provided support both from our care team providers and our MAT support groups. There is a lot of peer support around here for the recovery journey. and you'll be treated with appreciation. The team at Granite, the entire team understands that what the person is doing in terms of engaging recovery is a brave and admirable choice, and we respect and appreciate all of the efforts that the person does to improve their health, as well as the health of their families and the health of the communities. Next slide, please. So lots of places you can go in Nevada and Placer County to access care. A starting place for you might be the Nevada County or Placer County behavioral health systems, and they can, even though they generally don't provide direct medication assisted treatment, they can connect you to the services that you need. And then this other list down here are service providers within Placer and Nevada County that do provide medication assisted treatment. Now, Aegis, that top one there, is our referral for a person who we decide may be best suited for methadone. And then, of course, you can read the rest that provide buprenorphine. Also important to know is your primary care provider, once again, if they have received the training, can provide buprenorphine, and that might be your first stop. Next slide, please.
Alexa?
Yes.
I just wanted to jump in and mention that there's a few questions being posed. So maybe you can address those when you're done with your slide.
Okay. Tell you what, why don't we do that? Thanks for that. Why don't we finish the slides, and I will hand over to Gabe and he will start, and then we can do we can do the questions at the end. Will that work?
Sure.
Awesome. So I want to make sure we make it through what we need to make it through here. Okay. So yes, so we also have a warm line for MAT. You see it at the bottom down there. You can call this line, the 530-388-0359, or you can text, and we will get back to you and help answer as many questions as we have and guide you to the care that you need. Next slide, please. So we are here to help. And one step that you can take is to go onto the Granite Wellness website. You will see a big button that says Start Here, and you can put in your initial question about how to, what kind of care you're seeking or any other question you have, and we will get back to you. Again, alternatively, you can text our warm line. We will, if you want us to call you back, we'll call you back. If you want us to text you back, we can do that as well. But we are here to help all persons start on their road to recovery, and it is just a pleasure to be here today speaking with you and to work with this community. So what I'm going to do is I am going to step off here and hand the presentation over to my colleague who will discuss more about treating opioid overdose, and then we'll circle back and answer some questions. Okay.
Okay. Good afternoon, everybody. My name is Gabriel Ramirez. I'm part of the medical team here at Granite Wellness. I am the physician assistant that works here on a regular basis. And yeah, our mainstay is medical assisted treatment, of course, treating opiate use disorder. Next slide. I'm going to be talking about Naloxone or Narcan. I'm sure you guys have heard of it. It's a medication that reverses the high or the overdose of someone who has been using opioids. And it's a lifesaver. It really really reduces, and it really helps with the deaths of opioids out in our society. Should we play this video? Are we playing the video now?
Yeah, Trinity's bringing the video up.
Okay. So there's a video that needs I'd like to show you. It's kind of dramatic and a little graphic, so it shows us the real benefit of Narcan out in our society, out in the street. So let's go ahead and play that video.
Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril.
Great. Okay, let's resume the slides. Okay, so that video just shows the administration of Narcan when needed. Okay. This right, slide 20. Okay. So now we're going to kind of recognize when to consider when to administer Narcan or Naloxone. So symptoms we're going to be looking for on patients, muscles become relaxed. You're not going to really know that. They're going to be more flaccid. They're not going to be responding very well. Slurred speech, sleepy. nodding, minimal stimulation. So this column here just kind of recognizes somebody who was highly under the influence. On the right-hand side, somebody that's gurgling, literally unconscious, minimal breathing, pale, clammy skin, heavy nodding, and no response to stimulation. More than likely, that person is an overdose, and that's when you want to administer naloxone. Next slide. Okay. So very similar to those of you know CPR, kind of the same format. You try to wake the person up. If they're unable to respond, you want to call 911. In the film, it showed that Narcan was administered and then 911 was called, and I think that's the best bet here, the best format. Give your location to the 911 caller, and it says administer 1 dose. We already did that, and we want to wait at least 2 to 3 minutes to administer a second dose if no response. Again, if you have any doubts about person is under the influence or overdose of an opiate, and you want to go ahead and give it, administer Narcan, you're not going to do any damage, any harm to the patient. And the layperson or any person out there that comes across somebody who is unconscious and has overdosed, they are protected by the Good Samaritan law if they are given, and if they render aid by administering naloxone. Next slide. Okay. Kind of similar steps. You want to assess and measure any stimulation, inform 911, perform rescue breathing. So very similar to CPR, you want to check for breathing, check for circulation. If they're not breathing, you want to start on breathing. You want to give them administer rescue breaths, 1 breath every 5 seconds. You want to check for circulation, make sure their heart is beating. And if it is not, you want to perform CPR. Next slide. Okay, and this is kind of goes over the CPR format. Watch for a chest rise. That's how you kind of gauge the your breathing technique and if your breaths are going into the lungs. Next slide. Okay. So I think this is a good point. We're seeing a lot of fentanyl on the street, along with heroin, and a lot of times we're going to be needing maybe not only 1 dose of Narcan, maybe 2 doses of Narcan. If there's no response for the first administration, you want to wait at least 1 to 3 minutes for the second administration. It takes about 1 to 3 minutes for it to activate. And still no response, you want to go ahead and administer a second dose. But you also, if it is successful, then you be aware that you're going to have a very agitated patient. He's going to come around. He's going to be very agitated because you're going to be placing him in what we call withdrawal symptoms. And he's not going to be very happy. Next slide. Okay. It reverses overdose. I think my colleague Alexa kind of went over kind of the pharmacokinetics of medications. Narcan It's a fully opiate antagonizer. So what it does is just kind of clears those opiate receptors, and then just kind of just blankets it and removes any opiates on those receptors, and that's what causes the agitation and the awakeness and the withdrawals as well. Yes, it is safe on pregnant women and children. Next slide. And so you want to stand back. It's going to work fairly quickly. So many times people under the influence or overdosing, a lot of time they're engaged in illegal activities, and they probably have a lot of illegal issues surrounding that. And then as soon as they're awake, they might hesitate and to calling 911 or going to the hospital for evaluation. Just be aware of that. Or hold off on calling the cops, or they might even leave the scene if they are able to. Next slide. Okay. So, again, we work in the medical assisted treatment here in Granite Wellness. We do work with people with opiate use disorders. We have a wide range of treatments. Buprenorphine is our mainstay medication, but then there's others. We can refer to methadone to methadone clinic. There's naltrexone also we use, and our county is our referral point for these patients, and Placer and Nevada counties. So if you can go online, there's that website there. You can fill that out, and there is Narcan available. And any questions? I see there's a load of Q&A here. So
you can say Alexa and I are here and we can help with the Q&A.
Yes. So Alexa and I are here.
Hey, so Shelley, can you? I'm just going to come right over here with you.
Okay.
I gotta be careful. Shelley, do you want to read the questions? I think there are a couple questions that could be best addressed by Sheriff Moon.
Yeah, thank you. Yes. So we did have a question. Someone was asking if we are seeing carfentanil come into our community. And I don't know if Sheriff Moon is still on, but I wanted to pose that question to her if she is.
Yeah, absolutely. I answered on the question and answer, so I don't know if the person that asked the question got the answer, but the answer is we've heard about it in the community from citizens, but we haven't actually seen any or seized any to date. So that's not necessarily it's not here. It's just that we haven't seen it, and we understand. We don't see everything. Everything doesn't get reported, but we haven't seized any to date. None of the toxicology reports that we have on our 2020 or any years prior reports have carfentanil listed as being present.
Yes, thank you. And you probably, you are on top of it. You answered the other question I was going to pose to you as well about fentanyl. The question is, are we commonly seeing fentanyl in heroin or pressed pills? And
yeah, so the predominantly fentanyl by itself, and then we have a combination of a couple of fentanyl with methamphetamine, fentanyl with cocaine, and tragically we do have two deaths that are still pending toxicology that we haven't actually put in the category as an overdose, so we're still pending on those, but mostly that fentanyl by itself.
Thank you. Gosh. And
Other questions, Julie? We're not seeing the chat right now.
yeah, sure. I can read the other questions. So the age range was, I see you addressed that as well. 18 to 69 is the age range of the recent overdose deaths. So really impacting across all ages. Fortunately, no minors at this time, but we know that particularly the prescription pills are ending up in the hands of young people that aren't aware of how dangerous they are. So we really hope all of you will, you know, if there are young people in your life, please share this information.
And I think the drug take back day last weekend, I think across the board, we saw a great response from the community on turning in prescription medication. It was probably the most I've seen. We're still doing the translations and getting the weights so that we can submit that stuff. But what a great way for the community to come out and hear the message, so we know that they're hearing the message and responding and getting some of those prescription medications out of the house.
Yeah, and
Can
thanks
you speak a little bit more about what the drug take back day looks like?
Yeah, so the DEA does it once a year, and it's across the country. So we all partner locally with the law enforcement agencies, with Granite Wellness, and we try to put up different locations where if you've got prescription medications that have the narcotics, and or if not, it doesn't have to have a narcotic, but if you're in your residence and you no longer are using them, instead of leaving them in a prescription, containers and in your bathrooms, get that stuff and turn it in. We don't want you, putting it down the drain and putting it in the septic systems and things like that. Literally take them in. Once a day, we try to do a huge marketing so that people know where to go to drop those things off, and it allows so that no one's being tempted. A family member, a visitor in your home, or anything like that is, wanting potentially to take something like that. It gets it right out of the house. No questions asked. We don't take a report. We send in to the DEA the amount that we're able to locate, and then they'll put out a big marketing push to let the community know across the nation how much was turned in, which literally saves lives.
really valuable service that our law enforcement partners provide for the community. And so, yeah, and thank you. So there's a question here, and probably this one probably for you, Alexa. Is Granite Wellness considering utilizing Suboxone as opposed to Suboxone or Buprenorphine?
Well, Gabe, you want to do it, or do you want me to do it? I'll go ahead and start, and then Gabe can jump in if needed. So we do both, right? Generally, we start people on buprenorphine with, Suboxone, and one of the questions that usually comes up is, why is there Naloxone in my Suboxone? So Suboxone is a combination of buprenorphine and Naloxone, and the reason the Naloxone, the Narcan part, is in the buprenorphine is for safety. So that if the drug is used in a way that is not intended, such as injected, then the actual opioid effect gets canceled out. So that answers that question. But usually what we do is start people on Suboxone here, and then after a period of time, once the person has been stabilized and they feel like they're interested and ready, then we move the client to Suboxone, the monthly injection. There's also an implant that's out and available. I have not done it yet. I don't think, Gabe, have you done the implant yet? Not. And that would last for 6 months, but we have not done that up here yet.
Okay, great. And then here's an important one. Someone is asking, what is the average cost of treatment? Is admission based on triage, or what is the process for admissions?
I can jump in on that one. We're really fortunate. So it really depends on the funding source the person has. If someone is a Medi-Cal beneficiary, if someone has private insurance, if someone is uninsured or underinsured. Fortunately, in our community, we have a number of resources that support people in all of those categories. So there's very, very low barrier. We have grant funding. we and some of our other partners, I don't know if we've touched on that slide, I had to hop out for a minute, but you know, there are a number of partners that we talked about: Western Sierra Medical Clinic, Sierra Family Medical Clinic, Chapaday, Stalent. Our hospital starts people as well. But anyway, so a number of us also have, and Granite Wellness Centers included, that's actually the call I was on, is we have grant funding where we're able to support access for people that are uninsured or underinsured, to make it, you know, in many instances, there's no cost. I would say in most instances for folks that we serve, there's no cost to the patient. Many of the medications are covered by Medi-Cal. For Medi-Cal beneficiaries, like I said, insurance may cover, but where there's a gap, we have grant funding to cover for insured or underinsured folks that want to access that. So we're in a time, you know, this is such a priority, public health priority for our community leaders as well as state and federal leaders. We're really fortunate to be able to offer services with cost not being a barrier in most cases.
Great, thank you, Ariel. So really no barrier. Cost should not be a barrier for anyone. Just get in touch with us and we can, you know, work through how we can get you access to treatment, and we will.
Exactly, and I just want to emphasize that too, you know, folks, reach out to Granite Wellness. We can also support wherever the most appropriate access point is, even if it's not us. If somewhere's more, you know, closer geographically, or someone has a primary care provider already established at one of those other locations. But yeah, absolutely, reach out. Our confidential online inquiry form is a great place to start as well. Hopefully we put that link up, and then our counties as well can help route people. But yeah.
Great, and there's a whole bunch of questions here, and let's see, I want to make sure I capture them all. Somebody wants to know, will the slides be available? Yes, we're going to send them after. Also, there was some questions about put the website address to get Narcan kits, and we're going to be sending a lot of information following the training. And just a reminder, there's a survey at the end that you'll be taking. But in a few more minutes, so someone says, I'm taking Naloxone for alcohol cravings, but if I need pain relief for chronic pain, but I need pain relief for chronic pain.
Yeah, so you have to hold off on the medication for, I think, 10 days to get that out of your system. And then the provider, the doc, can probably introduce you to an opiate or a pain reliever. And there's
Good primary care provider.
yes, and hopefully they establish the primary care provider. Good thing about naloxone is that you don't need a special waiver for the provider to, unlike buprenorphine. So anybody can prescribe it. That's a prescriber. And
Okay. Wonderful. And then there's a question, can this still be used if a person is using both meth and opioids and overdosing? Excuse me.
It's not indicated. Naloxone is not indicated for those substance use disorders, but there is some data that it does.
Well, I don't know if they were asking about naltrexone. This is a separate question that says, can this still be used if a person is using both meth and opioids and overdosing? And I believe they're asking about Narcan.
Yeah. Yes. Narcan will reverse overdose of opioids. Only opioids. Now, if there's something else in the system, cocaine, meth. Yeah, it's uncommon for have a full meth cocaine overdose. It is possible, but the symptoms will be different. And no, the Narcan will not reverse that.
Okay, great. And the question, someone that works, they're one of the makers of Narcan nasal spray. They wanted to ensure that there are free Narcan available through DHCS. Yes. I believe we are aware. And then Somebody wanted to confirm thoughts on when to call 911 before or after the initial Narcan dose.
It's after. We want to administer that naloxone as soon as possible. Now, if there's a bystander, to have the bystander go as you're getting ready to administer the naloxone, but administer as soon as possible.
Okay. Okay, great. Well, gosh, I'm sorry. What we're going to try and do is copy all of the questions. Serenity is going to copy all of the questions that are posed. If we've missed any, we'll create a document answering all the questions and send that out with our follow-up email as well. And Serenity, I don't know if you can bring up that closing slide. And while you're doing that, one more question is, what is the percentage of clients that actually get completely off all medications?
Completely off medication. Does that include buprenorphine or methadone? The percent.
That one's probably hard to quantify. Yeah.
I don't know. I don't know any current.
We don't, I
data
don't think we have the data on that. It's very individualized.
Yeah.
Yeah. Okay. And so lastly, I just wanted to, I think Serenity is bringing up the closing slide, just, you know, what you all can do. And thank you all for jumping on. There's, you can be informed and you can know and share these resources that we've shared today. Contact us because as we've shared, there's so much help available. And just remember that overdose deaths are completely preventable. And we encourage all of us need to practice self-care for ourselves so that we are healthy. And so if we are in any helping role or can be of help to others, we need to always practice self-care. And then lastly, to obtain the free nasal kit, we'd love to get these in the hands of everyone that would like them. All you have to do is take the Survey Monkey, and one of the last, there's only, I think, 4 questions, so it's real brief. Here's the link, and we will email that out to you as well, to everyone, so you'll have it. And one of the last questions is, how can we contact you, and where would you like to pick up your kit? And we'll have them available at all of our sites in Grass Valley, Auburn, Truckee, all of Granite sites.
Kings Beach and Lincoln, yeah. And I just wanted to add one more thing, you know, for folks, seems like a really lot of good questions and we do need to wrap up. There's also a Narcan Now app. So Narcan, you know, is the brand name for naloxone, the primary maker of naloxone and the manufacturer for the nasal naloxone that will be distributed. So there's an app that downloads really quickly. It's a really simple app on the App Store called Narcan Now, and it walks folks through the steps and has a link to 911. So it's, you know, I think it's really an awesome resource to have literally in your back pocket at all times to support that. Just want to encourage folks to download that and check it out. A lot of good information.
Thanks, Ariel. And thank you everybody for joining the webinar today. We've gone 3 minutes over. Thank you to all our panelists. Thank you, Sheriff Moon and Alexa and Gabe and Ariel and everyone. And we hope everybody has a great rest of your day.
Thank you. Bye-bye.
Take care. Take care, everyone.
All right.
I'm going to give this back to you.